Well, it's really great pleasure of mine to host a dear friend and colleague who always, by the way, when I try to pronounce her last name, completely slaughter it, but she always is very generous and very nice, and she gives me a break. But I'm going to do my best this time. Dr. Aulakh, how's that?
Close. Aulakh.
Aulakh. Okay, well, not bad. I mean, I've said it worse, but in all seriousness, Dr. Aulakh, it's really a pleasure to have you on this show. We're going to talk after you introduce yourself about really challenges that face young academicians as they try to get their career take off. And I think there are certain elements that I would like to talk to you about and understand what are these challenges as someone is going through this young career right now, as well as maybe additional unique challenges pertaining to you being a woman or an immigrant and so forth. Now, first of all, tell listeners who you are, where you work, and how did you end up where you are right now?
So I'm Sonikpreet Aulakh. I am currently an assistant professor of medicine at West Virginia University. I'm a translational neuro-oncologist. I completed my med school in India, followed by a few clerkship rotations at Mount Sinai School of Medicine, followed by internal medicine residency at Wayne State University, and finally my hematology oncology fellowship with neuro-oncology as a subspecialty track. And I also did laboratory research during my 3 years of fellowship at Mayo Clinic. And I joined here at WVU as a translational neuro-oncologist as a result of the work which I did at Mayo Clinic. And it's been 2 years, and it's been going well so far. So that's what I do on a day-to-day basis.
That's great. So what drew you into neuro-oncology? Why specifically neuro-oncology?
First, I think if you talk about neuro-oncology and specifically talk about some of the most aggressive brain cancers, such as glioblastoma, midline gliomas, where we don't have effective treatment option, I think that was something which I felt was very challenging. And I think I had the right mentorship at the time when I was thinking of which pathway should I take as a subspecialty pathway in hematology oncology as a fellow. So I think I got right guidance at the right time. And obviously it was a lot of work both in the laboratory and in the clinic, but it was very gratifying at the end, knowing that the opportunities which I have from clinic to the bench side and vice versa, I otherwise would not have that availed to me.
That's great. So can I call you Sonik?
You can call me Sonik, Chadi. It almost feels weird when you say Dr. Aulakh.
Well, but we really want to talk a little bit about few items, but I want to start by talking about as a young academician, let's agree on the definition first of all, because we all are young, right? We're never going to age. But in academic life, let's agree that a young academician is someone who is less than 5 years from finishing fellowship, which it's been 2 years for you.
Yes, yeah.
First, when you were finishing fellowship and you were applying for various job opportunities, how was that experience? I mean, how did you know about job openings? How did you just call, email, send your CV? Did your mentor call? Like how does somebody who is finishing fellowship go about finding a job?
It's a very critical question and very important one, because it's something which you don't learn during training, because you're so absorbed in your training, in day-to-day routine, in day-to-day survival for that matter, that you just gotta finish your work, move on to next day. Especially I feel that during fellowship, and it's a challenge which everyone faces. I think people who want to go into academia, they face this as a more of a challenge because it's not a smooth path. There are a couple of things. First, do you email, call, or no contacts? I think I have done it all which ways. I have gone to several available online resources, ASCO, SNO, NIH, and looked for neuro-oncology job options, and I have emailed them, called them. And second, whether your mentor help or not, yes, they do. But academia is difficult in a way because if you're going for a laboratory-based pathway, then you have to have a different alignment of your goals within the institution for yourself. And how do you navigate that package for you? Your mentor definitely helps. Mine definitely helped me. But then when you have, say, 7 or 8 options, which options do you choose? Do you go for a center which is NCI designated versus non-NCI designated, one which is giving you more resources, one which is not giving you more resources? So I think there are so many layers to this question. But in the end, I feel like my decision was more based on where I'm getting the right opportunity to be nurtured as a young investigator, where I'm getting the opportunity to expand my clinical experience as well as my clinical trial portfolio. And everyone's needs are different, but you try always. One has to, because every institution's, I think, policies of embracing a young clinician investigator is different. And again, at that time, you really don't have many options to navigate through, because during research fellowship or during, say, clinical fellowship specifically, we're not being taught to apply for NIH grants, at least not in all institutions. And that's something which I feel like if taught better during your undergraduate, during your graduation, during your clinical fellowship.
Why NIH though? I mean, NIH grants are so difficult, right? Like, I mean, there are so many other opportunities to get grants. Could be pharma, could be patient advocacy, and so forth. I mean, NIH to me, it seems rather hard. Do you feel that in training you need to learn how to apply for NIH grants?
I personally think yes, and I had the opportunity to learn the process. I think all the grants which you mentioned are important, whether it is industry, whether it is intramural funding, extramural funding, but NIH takes precedence in a way when, especially, you are moving from a dependent investigator to an independent investigator, because it allows that transition, it allows that commitment between mentor and mentee. It kind of enhances that, I think, relationship in a way. But others are equally important, I would say.
So before we get, I want to still go back into the job issue, because I do find this particular item important, especially to listeners who are either in fellowship or training or even young career. So you just go to these online resources and you look what's available, and then do you go back to your mentor and say, hey, you know, I found these 3 jobs. Do you know anybody there to call? Should I apply? Like, when you find these online resources, first of all, how much do you depend to apply or not to apply on your mentors? And number 2, are there opportunities that are not advertised for, that your mentor says, hey, let me just call somebody I know at so-and-so place, and maybe they have a position and all of that? Or is this really not something that happens?
I think, again, a very, very important question. Online resources do not cover the job opportunities which are fully available out there. They do not. They may have 1 or 2 options, but the the best way, which I found is also a tedious way, is to go to individual centers and look for how many neuro-oncologists they have. In my case, uh, is there one or two? Then you email the chair, and then you go back to your mentor and you ask them, hey, what do you think about this program? Do you think it's not necessarily person? I think I didn't want to be biased about a person who is running the program, because all these mentors are senior people, and what my basic question was, as a young fellow, what do you think about this institution? Would it be nurturing enough for me or not? If I go there, do you think there would be career opportunities to grow into my current position and apply for grants, etc. But in order to answer both of your question, I think first, online resources will not cover everything which one needs to know about available job opportunities, because there are certain community hospitals which also have jobs. They also have research resources, but it, 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 it might be missed. And second, definitely, I did seek out to my mentors, and not just my immediate mentors, but outside people whom I knew in the field.
By the way, when did you start this process? So it was a 3-year program, your fellowship, right?
Yeah.
When did you start doing that?
So I started looking into second half of my second year.
Really? That's fast, because I'm okay. Well, all right. Well, the reason I think this is so fast, because, okay, so it's a 3-year program. I mean, in order for you to apply for a neuro-oncology fellowship, which is obviously, it's a super subspecialty, you have to show that you've done something in neuro-oncology. So you're giving yourself only a year and a half of fellowship to have like something in neuro-oncology. It seems to me so difficult to have really even a paper in a year and a half sometimes.
You're right, it's difficult, but when you start early, it actually helps you understand what else you need to do to enhance your CV, because then there are options like you take a break for a year after your clinical plus research fellowship. Do you want to do it or not? Should you be staying in the same institution or not? Should you be going somewhere out to do this fellowship or not? And then you ask your mentor how ready I am. So I think it kind of, starting early, I think it's not just that you'll find the job right away, but starting early helps you prepare better.
You gotta put your feelers out there and just see.
Yeah, it's a daunting process to start finding. All of a sudden, you I feel like you have steep learning curve.
So now you have, let's say, a couple of options, 2-3 options that you. Well, first of all, when you go there as to interview, you oftentimes give a talk, I presume, or something like you get invited to give a talk and so on. If there's a fellow that's listening to this podcast, give me the 5 questions that you absolutely have to ask in an interview process when you are interviewing for a job as a young faculty career.
Yeah. Again, that's very important. And I figured out what those 5 questions were, or actually the list is longer, but they're, the top 5. First, I think depends on whom you are asking, depends upon what kind of institution you're applying to, what kind of job opportunity you're applying to. For example, in my case, I wanted to know, would it be possible for me to practice my laboratory translational research and run a brain tumor clinic? Second question was, is there a mentorship model there? Is there a mentoring committee there? It doesn't have to be from my same field, but people who are more experienced, who can help me read my grants, review it, help me review my papers. I think this was very important to me. Then obviously you do talk about salary because it's important, that whether it is just the based on RVUs, do you have a fixed base salary? And what if I have grants, where does that go? And in my case, I also ask questions around clinical trials. Do you have phase 1 unit? Do you have a capability to expand phase 1 to phase 2? And fifth, I think just the networking environment within the institution, where you actually have the opportunity to not just collaborate with people who are immediately in your field, but also say biochemistry, physiology, immunology, microbiology, who can help facilitate some of your questions. So I think for me, these were top 5 questions. And if you want to go to the 6th, that what's the environment of, do you have a MD PhD program? Do you have a PhD program? Do you have trainees? And how do we best help them reach to their goals? If somebody like me is coming, it may be new to the institutions. And these are very, very important questions. A person who's going to a community hospital may have a different set of questions. Yeah.
Did geographic location play a role, or do you recommend for young trainees as they're embarking on their career? Barring obviously family restrictions, right? Let's say you absolutely have to stay in a particular city. Do you add a factor for geographic location in your selection process?
I personally did not. I wanted to interview as many places as were possible. But I know in reality, there are, family ties and restrictions. And in that case, I think if I because I encountered that scenario in my head, that what if I had to choose a place based on the location? And then I thought, then maybe I'll have to think about perhaps downsizing my requirements. If the place which I want to reside at doesn't have the same institutional capacity. So I think there is this fine balance between dreams versus reality.
Well, if you have to choose based on pizza and food, Chicago would have been your choice. But so then, Sonik, you ended up at WVU. Obviously, there was something that attracted you to that university, but we're talking more broadly on that. But how much do you feel trainees coming out of fellowship really have negotiating power when they are coming into an institution? And what I mean by that, because what I feel like there's sometimes asymmetry, like the institution is big and large and so forth, and you're like this young fellow trying to get a job. In your experience, did you feel you were able to go head to head and say, well, maybe I want a little bit more money, maybe I need more protected time, maybe I need more lab protection? How was your negotiating process? How did that go? And or did you even feel, okay, there's nothing I can negotiate, either I sign or I go elsewhere?
Very important question. I think it's, as I was saying earlier, it's a daunting process for a young trainee to look for jobs and demand in a way, not because we are just demanding irrationally, but demanding in a way that we deserve it. It was almost, I had to instantly learn, and my mentors really helped me.
So they helped you in looking at the contract or something, or?
The key points. When I asked them, what would you ask when I will be asked this question? It was that kind of a exercise. But obviously, there are certain key elements which are just specific to an individual, in my case, to me, that you're not really comfortable asking. But I think what really helps is, in my case, what really helped here was the hiring committee. I think they were very transparent, and they had already told me, this is doable, this is not doable, these are your options, these are negotiable, these are non-negotiable. And then I went back and I read it, I read more about it. And I think there comes a time where you certainly have to, maybe, to put it mildly, compromise somewhere. But if you ask me now, if I how would I have done it differently 2 years ago? I don't think I would have done it differently. I think I would have.
Did you have to have it reviewed by a lawyer, like legal help?
Yeah, I actually had a lawyer to review it. Although it was straightforward kind of a contract, but because of other elements, tail insurance, and all that, I wanted to make sure I'm signing the right contracts. But I think
most universities cover tail insurance, right?
Yeah. But I think this one also does. But getting advice from the people who have done it, I think is very crucial. Whether they're your mentors or they're your, colleagues whom you trust, or whether there's a family member whom you trust, somebody has to just read in between lines. I read it multiple times.
So I want to add an element to your situation, which is you're an immigrant from India. You've been in the States for how long, Sonik, now?
I first came in 2011, so almost 10 years.
About 10 years. I want to add this element a little bit to the story. We haven't gotten to the job yet. We just pre-job right now. Did you feel at all that being an immigrant or somebody who has gone to a medical school outside of the States had any, let's say, set you back in as you were applying or anything, or the fact that now you finished residency and fellowship, you're like later on in the career where you went to medical school became less important, or maybe you didn't feel how add the color of being an immigrant, and do you feel it had any impact?
It has its elements where you kind of go back in time and ask yourself, could you have done the same thing, say 5 years ago or 10 years ago, which you're doing now? Was it, and I feel like there are few things which remarkably stand, as coming from a different world where we didn't had many research opportunities. We didn't had any idea about MD, PhD, dual pathway. We didn't had idea about, how to conduct research. And I would say, for that matter, mentor-mentee relationship. I think that and when you learn this during the course of your residency, during the course of your training, including fellowship, it doesn't come naturally. It's almost like you have to learn it, you have to absorb it. I don't think necessarily it impacted where I am today and where I would be in 10 years from now. It certainly didn't impact that, because there's a time for everything. You can start learning from, but I think knowing it earlier, knowing that these things help you get a job.
Maybe
I think
maybe it has an impact when you apply for residency more than for faculty, because now you've done residency and fellowship here. I don't know.
It definitely, the element stays there, that you have visa issue, you have you are limited in your grant options. You're not able to get all grants. Um, there are, but I think in the bigger scheme of things, I don't think it matters. I think if you are talented enough and have enough potential, and you portray that on your CV, in your conversation, and you are a reliable person, you are an intelligent and hardworking person, I think it doesn't matter. But that's more like a philosophical / scientific note. But on papers, it may carry some significance.
So then you started your career as a faculty member, and just for listeners, I know you're a translational scientist. So what does that mean? Like, how much lab time do you have? How much clinic time? How much inpatient service? How much can you just divide a pie chart? Think of a pie chart, and how do you spend your time?
So, when we talk about a physician scientist or a translational scientist, we talk about having clinical duties and we talk about having research duties. So in clinical duties, it's close to 50-50, but there is an overlap. It's never 50-50 because, but it allows you to at least focus, or you keep adjusting your time accordingly. Between clinic and lab. I think ideally people go 60% of research, 40% of clinic, or 70% of research, 30% of clinic, or 75% of research and 25% of clinic.
You're 50-50?
Yeah, 50.
And as a young investigator having 50% of the lab, does the institution give you some seed money to buy equipment, to hire postdocs, to, I don't know, like, do they give you some money at least to get started?
Yeah, you get a starting package, and we call it startup lab package. And then it's enough to get equipment, and then you have common shared equipment, and then you can hire people, lab tech, postdoctoral fellow.
Oh, that's great. Okay,
Yeah.
that's good. And that startup package, keeps you alive for 3 years?
Not too long. Not too long.
Well, how long?
It depends. If it's a tenure track position, then you want to get a grant, ideally by on papers by third or fourth year, and at least by fourth year. But in my case, because of COVID pandemic, in everybody else's case, COVID pandemic was actually had a huge impact on not just on young investigators' careers, but others investigators' careers. But I think 4 to 5 years, they say you should have an independent extramural funding.
So they'll be patient with you up to 5 years, and then somebody's going to talk to you.
Yeah.
But during those 5 years, Sonik, the expectations are what exactly as a young investigator? Are the I'm trying just to understand, are the expectations, you need to have an R01, you need to have just some money to cover your salary, you need to, what do you need to accomplish by year 5?
So extramural funding, definitely.
Does it matter from where?
It matters in a way that, say, if you were talking about NIH funding, right? If you have NIH funding, it's considered to be rigorously peer reviewed and prestige. But as long as your lab is alive with the extramural funding, because there are certain other funding agencies such as ASCO and Sontag, and there are a couple more, AVTA in my case. You keep looking for those and just keep applying.
So do you but I'm just putting myself as a funding agency. Mm-hmm. You have to show me something to decide to fund you, right? Mm-hmm. So do you feel, do you try to work for a couple of years to establish the basis of what you're applying for? Do you apply day one and just start hitting the ground and say, this is what I'm planning on doing? Like, somebody is listening, what do they need to do in year one and year two?
I think it's impossible to apply on day one, because if you're first of all, if you're a funding agency, all funding agencies has different set of criteria. Some prefer clinical trial. Some are okay if you don't have clinical trials. Some prefer some prelim data. Some prefer it's okay if you have just an idea or a hypothesis. Some prefer a combination. I think regardless, you need time to hypothesize, to sit down, to plan your experiment, to analyze the data, to get it critically reviewed by your own peers first, by your own colleagues first, before you can actually apply for a funding. But you can still learn the process by simultaneously performing your experiments and writing. But unless it's vetted by a few people whom you trust, I don't think day one application is even feasible.
How challenging it is to get funding?
It is challenging. There's no denying about it. It's a lot of efforts, competition, how novel your idea is, and
as a young investigator, if you're applying to a funding agency and there's a senior investigator that's applying for the same funding agency, different ideas, I'm not saying it's the same idea. I mean, am I being too naive to think that the funding agency may be more drawn to the senior person because it has more established record, they know him or her, and they say, okay, you know what, we may as well just go with this person because he has a track record. Sonik is younger, she may be great, but we just don't know that. Like how, I don't know, is this too naive of me to think?
Answer to that is, now, because we are diversifying how the funding should go, whom should it go to, I think there certainly is an equity, I think, in early career investigators funding process, because there are special sort of requirements in how long ago you graduated from your program, and within 5 years to 7 years. So I don't think we are directly competing with the senior investigators, but I think we're directly competing with the quality and the experience and the questions which we are asking. Are they of that caliber where it should be funded or not? It's I don't think I see that one would be preferred over the other.
Okay, so I want to add an additional layer here with you being a female and a successful, accomplished woman. But do you feel that there's any more specific challenges as you're trying to kick off your academic career as a translational scientist that may be specific to you because you are a woman versus what men might encounter as they're trying to kick off their academic work?
I think there is data which suggests over last 10 years that there were challenges which were more faced by women, either due to underrepresentation or just lack of resources provided. But I think it's changing now, and it's changing very rapidly, because most of the funding agencies are providing special packages to young investigators, and then there is a women in medicine, there is immigrant women of color. So I think that notion is kind of diluting slowly but surely.
So there is, I mean, that you feel it has improved over the past 10 years.
Yeah, absolutely. Based on data, based on what we see now, I feel that it's improving slowly, for sure.
So I asked you earlier, Sonik, about the top 5 questions you would ask or you would advise somebody to ask. I'm going to still go into the theme of top 5. What are the top 5 challenges that maybe you're facing as an early investigator career, less than 5 years out from fellowship, that you think others might be facing as well, and they need to really figure out how to navigate? They may not be 5, but I would say I'll give you up to 5.
I think time management, it's big.
Tell us about that.
Yeah, especially.
Yeah. Tell us about the time management. What do you mean by that?
So, between clinical duties and between running a lab and generating the data and setting time aside to write grants, and then really thinking through your hypothesis and running it by someone who's more experienced, and if and then kind of listening to your own scientific rationale. I think it's a process, and it demands thinking, a lot of thinking. So I think time management, I would say, especially if you are a translational scientist, it could be one of the challenges. And that's why, during your contract negotiation or during your research funding process, we always ask for 70-30, 60-40, 50-50% of division of time. Second, I think competition. There is huge competition in getting research funding. Everybody is trying to get the best quality of research out there, and then it becomes a process where you just need to be out there and continuously apply for research grants. Third, I would say, which we were just talking about, diversification. I think it's already happening where people who may not have the same opportunities. For example, in my case, I didn't do any research fellowship during my undergraduate program, or during initial years of my graduation, and I did it in later half. So I think that also could become a challenge. I don't think necessarily it is a challenge, but it definitely can become a challenge. And then I think finding the right mentors, both institutionally and out of institution, it's a commitment, both from a mentor and a mentee, I think, standpoint of view, that how their relationship is helping the grants to materialize, papers to materialize, and the ideas, because it all starts from an idea. I think fifth is to say, if you have postdoctoral fellow, you have lab technician, or you have graduate students and you have undergraduate students, how do you keep up with all of that? In addition to your own, because you're also teaching at the time. So you're not only giving them the ideas about the research, you're teaching them, you're sitting there on the bench and teaching them. I think, and there could be many more challenges depending upon every person's specific situation. But I think in my mind, these are the top 5, I would say.
And you are serving as a mentor to these folks. Where how easy it is to find mentors outside of your institution. I mean, folks that can, advance your career that you don't work with. Is that tough?
I think you initially start with knowing each other, trying to have some collaborative effort, because it's a commitment. It's a time commitment from mentor who's senior to you and who's more busy than you are. And once you develop that level of trust and that level of, I think, collaboration, then it becomes an easy process. I think both, it doesn't matter if it's an institution or outside institution. I think for me, it's the same, both in the institution and outside institution.
So Nick, how are you assessing your success early on in your career? Is it purely if you get money or not? I mean, is that, and the second question I'm gonna after that is, I'm sure you have I probably should have had another colleague who is not translational, because you have a unique perspective, which is lab and so on. I wonder for those on a clinical track, how they negotiate. That actually gives me an idea for another podcast. But how are you assessing your success? I mean, is it like, again, is it show me the dollar sign?
Um, dollar sign, I think in the research world kind of affirms that your research is fundable. It I don't think you work for the dollar. I think you work for
Yeah, but
the
that's what I meant. I meant like
yeah, yeah. It kind of allows you to, I think, just run your um, ideas, run your innovative ideas and actually materialize it. So I think in that aspect, funding becomes huge, and I think it's important. But do I see that as a sign of success? I think if there's good science out there, people are reading it. I think that to me is more gratifying than just the dollar sign.
all right. So we're gonna talk about worst and best case scenarios, and I know you've been very generous. I promise you just a couple of more minutes. This has been really amazing, and I hope listeners realize how great this is. But worst case scenario, you get no extramural fundings within a 5-year allocated time, which I know it's unlikely. I know how hard worker you are, but still, it's certainly not a zero possibility. And we always prepare for for the worst and plan for it. What would you do then? What do you think? What would be the options? And number two, you get extramural funding, and you're well, and you're doing fine within those 5 years. What would you do after that in 5 years? So take us through both scenarios, because I know colleagues of mine who did not get the funding that they expected, and they had to actually make changes. Frankly, some of them left institutions, others went to clinical, all of that stuff. I mean, we know that these things happen. But in your own words, take us through best case scenario, what that looks like, and worst case scenario, what that looks like.
I think best case scenario is we'll continue what we are doing. We'll continue what I'm doing in terms of finding best treatment for highly aggressive brain cancers. In worst case scenario, it's not that I didn't think about it before stepping in, because it's very unconventional. There are very few physician scientists out there. I just thought that worst case scenario would be I learned a lot, and then just perhaps if it will. It's difficult to answer that question, first of all, because in my own head I thought about it and I could never answer that.
That's why you're on Healthcare Unfiltered.
That's true. I think I will some shape or form. I will still pursue this, maybe not at the same scale, and then find my way to get back to where I needed to be. If absolutely I can't practice what I'm doing, then I guess I'll have to rethink of the ways which I was working in the past, and then perhaps just modify it. I don't know the right answer.
Well, let's hope we
scenario.
hope we don't really get to that.
Yeah.
Hope
Yeah.
this
No, it's a good question. It's a very reflective question.
Yeah, I mean, I say that because I think it's like, you submit a paper, worst case scenario, it doesn't get accepted,
Rejected.
you go elsewhere, or etc. Anything I forgot to ask you that you think is relevant? I mean, my goal of this episode was to highlight potential challenges that young investigators, young career physicians might face, even from the time they're trying to apply for a job, as they maybe negotiate, and then even after they start the role. Like I said, you're a translational scientist, so some of the things that you said pertaining to lab and startup package may not really apply to
Yeah.
folks coming on clinical grants, clinical track. Are you able to comment on the clinical track, folks? I mean, do you know people and friends? Can you maybe give us a little bit of some light into that other track?
I think clinical track is equally important because even if I take my case, I have clinical track. I have both the tracks, but clinical track becomes more important in whether you want to practice, say, hematology, oncology, both these subjects, or you want to subspecialize in one aspect of hematology, oncology, and then where do you do it? Do you want to pursue an academics, or you want to do a private practice? And again, student debt is real. I mean, we have all gone through that. That also becomes an issue, and one of the best advice I think which I got from my mentors was, Sonik, interview as many places as you can, because it allows you to not only just meet several physicians and several other folks whom you will learn from, but it'll allow you to introspect into other institutions that and I think that was such a great advice. I think both clinical track as well as for non-clinical slash lab-based track, that it gave you a perspective. Some of the places I interviewed, I was amazed, like how wow, this is a very well established system. They have these many resources. So I think I think we should all be bold as young investigators in knowing our strengths more than our weaknesses, and then really asking the right questions to the right folks at the right institution, and just and go to more places.
Yeah. Well, Sonik, this has been great, really. I've enjoyed it immensely, just getting to know you a little bit more, your ambition, what you're trying to accomplish. And, I think there are certain elements in the story in terms of the challenges and the opportunities. And would like to have you in about a year or so, if Healthcare Unfiltered is still on the air and nobody really decides to never have me on the air. So we continue follow up on the progress. Anything else you want to tell listeners as we part ways?
No, thank you. It's been wonderful, Chadi, as always. Thank you
so much.